Spa Medica partnered with OT to explore how optometrists are working with their services, discussing how they prepare the patient to be sent in for referral and how the process is when the patient comes back. We gathered 3 CPs with lived experience in their area, each with individual challenges. First, we wanted to know how they feel about having services like Spa Medica available in their local area.
It just opens up another avenue for referral when waiting lists are just getting ever longer. To give patients an option, I think is brilliant, and also to open up the referral process so that hopefully waiting lists can come down, more people can get their surgery, we can keep happier patients driving longer and just having happier lives.
The most important thing to me is that they have choice.
In Bury, where I am, the patients, if they're already under the hospital for, say, something else like glaucoma, they can go to another provider for their cataract. In another local area, the hospital insists that if the patient is under their care, then they can't have their cataract done elsewhere. So it does limit where they can go and limit their choice. And that's just something that is agreed locally.
How do you find communication, both with the patient and with the secondary care provider? Is it something that you find important or valuable?
Normally, once I've discussed everything with them in the room, I will give them the NHS information and I will write down, that they will get a call and they go then through the cataract referral centre. I will always write my name and store number on the top of the leaflet. Generally, when they've been and they've had pre-assessment, I always encourage them, if they've got any questions, give us a call. Sometimes it might be that I don't know and I do have to touch base and say, the patient's got this query, are you happy for me to see them or did you want to see them back? And I suppose that depends on what the problem is.
Having really good relationship with your providers, I think really helps. As an optom, making sure I've touched base with wherever I'm sending patients to. I think having that communication backwards and forwards helps wherever they're going, whatever their surgery is, just forging really good relationships with the treatment centres, I think, is key for us.
Bottom line is we're always happy to talk to our patients. There's no limit for them getting in touch with us. We're happy to try and get in touch with all of the providers when a patient's got a worry or a difficulty getting through. Spa Medica is top of the list here in terms of communicating with patients as well. It's so much easier than getting in touch with your local hospital or indeed community eye care. It's your door seems very much open.
Walk us through what you do when referring a patient into secondary care. Do you have any tips to make the process smoother? Say, for example, a patient being referred for cataract, but who also suffers from dry eye.
I try and talk to the patient about what generally the referral will involve. The Spa Medica locally do give all of the patients some dry eye drops. I kind of tell them when they need to use them and emphasise the importance of that, because whilst they're given drops for dry eye, I think sometimes there's so much going on, or they go, my eyes aren't dry, and they don't recognise what those symptoms are. We try and identify the patients with blepharitis and try and get them to comply with that. That can be a bit more difficult. It's just kind of setting their expectations and telling them that ultimately if they do what they've been told and they start doing the blepharitis treatment, it will make their overall clinical procedure so much more successful and more comfortable, I suppose, is the best way of putting it. The other way we sometimes try and get them to use the dry eye drops, as well as obviously from a comfort point of view, is if they can get used to handling and putting drops in before they then have the surgery, then when they have the additional drops after the surgery, that's just something else to add into the routine that they've already got going.
I always try and say, have a good go at getting the drops in, make sure, even if some of it goes down your face, at least some will go in your eye. We tried sometimes to get applicators to use with the drop bottles. Not easy to get, to be honest. Some patients really struggle with some of the bottles, going through with them how to put them in. And if they struggle with one type, trying to find a different one. It's just finding what works so that they can use them.
What do you do when the patient has had their surgery? How much communication do you do back and forth? Do you need to do anything to retain them as your patient?
You want your patients to come back to you. Why wouldn't you? You want to touch base with the patient as soon as possible after their surgery. To make sure that everything's all right, to just forge that sort of communication with them to if they've got any problems so that they can come back to you. So as soon as we get the letter, we would then contact the patient and just say, you know, obviously you've had your surgery done. How have things gone? Is everything okay? We'll book you in for your post-op check. It all encourages patient loyalty. You want to look after your patients. You want them back. So the sooner you can contact them, the better.
I always also make a point of telling the patient that, you know, the results that I do during the post-operative check, they get uploaded and sent back to the surgeon, and I make it clear to the patient that that communication is there, and if there are any concerns, I will fill that in on, I use Medisoft with Spa Medica, and then that will get kind of flagged up, and you know, we'll go from there.
What I do like, if I've got any doubt, certainly with Spa Medica, I can pick the phone up and I'm talking to a clinician. And that's always been great. But I've had to do that 10 years, twice maybe. So it's not a big thing, but it's nice to know you've got it there if you need it.
I think having the communication link where we can just ring up and speak to the clinical triage, that helps enormously. You know, even just, you know, sort of ringing them up and just, this is what I've got. What do you think? Sometimes they'll say, all right, well, yeah, just monitor that, maybe see them again in a week or 2 weeks or whatever, just rather than necessarily having to send everything in. I've certainly used that to speak to the clinical team.
Having that communication, it kind of makes me know I can then refine my communication back, because I know what's important and what's not. So when you get that feedback, you know, if you've gone through it and you've got the experience, you kind of then know what's more important and needs to be prioritised and what you don't have to be quite as worried about, which is also helpful.
The better communication you have with them, the better service you can provide to your patients, and the better sort of outcomes, not necessarily outcomes in terms of the surgery, but your communication outcomes will be far better.